Hello and welcome to episode 16 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is inflammation, low back pain. How can you manage inflammation, reduce inflammation, understand inflammation, and the relationship it might have with your low back pain? Now, to initially set the tone here, the type of inflammation we want to focus on is not acute inflammation. This is not a topic regarding an acute flare-up. Previous podcast, which was just recorded, which if you have not listened to it, you should absolutely listen to it. I discussed the management and some of my initial approaches to low back pain flare-ups and how to get through flare-ups. Are that we don't want to address acute inflammation. With any injury, we really don't want to address acute inflammation. That is the body's natural response. It's a recovery response. It's a healing response. That is not something we want to mess with. The focus of today's conversation is systemic, chronic inflammation that could not only be related to your low back pain, but to many, many other things as well. Different injuries, sleep, mental health, just overall well-being. These are things that could be influenced by overall systemic chronic inflammation. But the examples and scenarios we're going to discuss today are focused on low back issues. And I have a few very practical examples from clients that I have where we discovered some quite significant dietary influences and inflammatory influences that ended up being present for their low back related issues. Now, once again, one more time before I dive into this, there was another podcast I recorded where we discussed how an inflamed disc is actually quite beneficial. We want inflammation. We don't want to immediately run to anti-inflammatories or injections that are going to douse the inflammation. I just want to make it very clear that inflammation is a good thing in the right environment. We are discussing chronic systemic inflammation. I really want to hammer that because it's very important to discern the two. Okay? So, my two client examples I have for you. This could be very, very beneficial, so listen up. I have a client named Sadia. She's out in Alabama. She's a teacher. She's an amazing teacher. Very energetic, loves her kids, and she was an awesome client. One thing that we discovered throughout our journey, she started my program with low back pain and sciatica. We were able to get her low back pain and sciatica under control within the first 3 months. Significantly improved range of motion, significantly reduced the sciatica. She was back doing 90% of everything she wanted to by the halfway mark. It was an incredible experience. But something that she found, and this is actually on her own, this wasn't necessarily per my recommendations because we were making such good results. Something she discovered on her own is that every once in a while, she would have a small flare-up. And this is not uncommon, especially if you're going through, early stages of rehab. If you've had a low back issue for quite some time and you're going through a rehab program, it's not uncommon to have flare-ups, okay? Multiple of my clients will experience flare-ups at some point. It's because there's so many factors that influence the way that you feel and the way that your low back feels too that are not always controllable. Stress factors, emotional factors, personal life, job demands. There's a lot of things. So flare-ups are somewhat normal, but something she found throughout our journey together is that whenever she was going through a flare-up, when she would go gluten-free, immediately her symptoms would reduce or completely eliminate. So although we had achieved like 90% improvement without any dietary modifications at all, without any lifestyle modifications outside of, the change in habits and the exercises that I was prescribing her, she found that if that low back was still kind of lingering, that last 10% was kind of there, or if she had a stressful week at work or was on her feet more or whatever, and she would kind of get flared up a little bit, the second she went gluten-free, flare-ups significantly reduced, and that last little bit of lingering pain she was experiencing went away. So we achieved about 90% recovery without any dietary influences, but that final dietary change she made on her own, or at least discovered, was enough to take it the rest of the way. So guess what? Now she's living a either gluten-free or gluten-controlled lifestyle to keep that component in check. Another client I have out in California. This is somewhat recent. This is within the last couple weeks. She was going through a flare-up, similar scenario to Sadia. This client's name is Allison. Allison, if you're listening, awesome, super dedicated client. I love her. She's fantastic. We were going through more of an acute flare-up kind of scenario. And Allison is very knowledgeable. She's well-versed. And we're having a little bit of difficulty getting through this particular flare-up. So she used her knowledge, and we discussed this a little bit as well, but she used her knowledge to essentially go keto during that time period to help improve her rate of recovery through this flare-up to reduce inflammation in more of an acute style scenario. Yes, she was still, dealing with low back issues off and on. We've been working through the program. So it wasn't something that was like, multiple years in the past. Like we're actively working through it, of course. So it was heightened. It wasn't just out of nowhere. It was heightened, but she eliminated starches, sugars, grains, flours, focused on just basically meats, good oils, some fruits, essentially went keto or a very anti-inflammatory based diet for that time period to accelerate the rate at which she was recovering. It was very wise and it helped. And that is a tool that she uses. So dietary influences can have an effect on low back issues. What I found in my personal experience helping hundreds of people around the world with low back issues, mostly disc herniation and sciatica, dietary influences are never going to be like the number one home run for these things. I've never met anyone who has completely fixed low back issues off of diet alone. There's just too many factors that affect low back pain. Mostly movement and exercise-based interventions are required. Like I said, with Sadia, we got 90% improvement. The last 10% came from dietary intervention, but dietary intervention can be helpful for not only low back issues, but many other lifestyle factors as well, and just overall well-being factors, health factors, right? So a few specifics that you can implement into your life right now, okay? I encourage you to look up the Dflame Diet. That is a fantastic book. It is a fantastic resource by Dr. Seaman. Dr. Seaman wrote that book and is well known for it. It basically just discusses an overall anti-inflammatory diet. As I suggested earlier, reducing starches, high omega-6 oils, reducing flours, reducing sugars, and then focusing mostly on meat, veggies, some fruits, and healthy high omega-6 oils. That's essentially the dietary change. And this is a good foundation, good starting point for an anti-inflammatory diet, which is going to eventually change your blood markers and affect your inflammation systemically. Here are some specifics and some cool facts for you, okay? In individuals with chronic lower back pain, they found a decrease in interleukin 10. Interleukin 10 is a anti-inflammatory cytokine. Most interleukins are cytokines. Most cytokines are referred to as inflammatory cytokines. This is an anti-inflammatory cytokine. We want more interleukin 10. And guess what? Ways that you can increase interleukin 10. Exercise, caloric restriction, and sunlight. So getting outside, moving, and not overeating will increase your interleukin 10. It will increase your anti-inflammatory cytokines and will help the overall systemic inflammation of your body. Boom, practical application right there. Additionally, individuals with chronic lower back pain showed elevated levels of TNF, tumor necrosis factor. Guess how we can reduce that? That is a pro-inflammatory cytokine. And once again, we want these pro-inflammatory cytokines during an acute injury for inflammation purposes. Inflammation is not a bad thing. It is a good thing in the acute stage. It is a good thing. Chronic inflammation is when that inflammation lingers longer than it should. Okay. TNF in a chronic state, we don't want that super high and out of control. Ways that you can reduce that. Well, TNF lives in fat. So exercise will reduce it. Caloric restriction will reduce it. Two of the things that increase interleukin 10 as well. Okay, so essentially what we're saying here is if you want to reduce some of the components that increase risk or that are at least present in individuals with chronic lower back pain, you want to be exercising, you want to not be overeating, and you want to get in the sun. Simple way to live a healthy lifestyle that are going to affect multiple things. And I've discussed the power of sunlight and getting in the sun in the morning and night multiple times. This is actually a mandatory part of my program. Now, last couple things. Oils. Oils can be good. Oils can be bad. It also depends on where your current state are. We want a certain ratio of omega-6 to omega-3 oils. Generally speaking, this is slightly incorrect to say this, but generally speaking, omega-3 oil is good, omega-6 bad. That's very general and not totally correct. We want a certain ratio of them. Okay, so we don't want all omega-3. We don't want all omega-6. We don't want no omega-6. We don't want no omega-3. We want a good balance between those two. I mean, there are no few oils. There's just two, omega-6 and omega-3. So what are some foods that are high in omega-3 oils? Seafood, most seafood, right? Flaxseed, chia seeds, and certain nuts. Okay, you can look up multiple lists, but those are foods that contain high omega-3 properties. Now, omega-6 oils, right? We want some omega-6, but not in overabundance. Once again, certain nuts will contain omega-6. Avocados will. Eggs will, the yolk, right? That does not mean they're bad. People are thinking, what? Omega-6 is bad, but avocados and eggs have omega-6? What? I thought I was supposed to eat those things. Those are good things. They are good things. They are good things, okay? They're not bad. We just want the proper ratios. And most Americans, at least, I know I have international listeners, but if we talk about the standard American diet, most people have a far abundance of omega-6 because also high amount of omega-6s exist in vegetable oils. Vegetable oils are put in many, many foods that typical Americans eat. Fried foods, extra tasty foods, right? So most people have a far abundance of omega-6, so they need to get that under control. A healthy individual with good blood markers, a nice anti-inflammatory diet, they might need some omega-6 to keep a proper balance, a proper ratio. But most individuals, they don't need to think, oh, well, I need to maintain a good ratio, so I need to keep eating omega-6s because I don't want that to get too low. Most people are going to be far too high in omega-6s, okay? So initially, they would want to restrict that, get it under control, get to a proper physique, a proper body weight, get their blood work under control, and then they can focus on having enough omega-6s for a proper ratio. But initially, all those fried foods, vegetable oils, all those things, once again, starches, sugars, flours, those are all going to contribute to poor health markers related to these inflammatory components. So that is it for inflammation and low back pain. We wanted to keep it simple, not dive super, super deep into anything complex, but discuss some simple factors that you can implement that are practical into your lifestyle right now. So in summary, we discussed two different client scenarios who are able to help their low back issues due to dietary changes. We discussed ways that you can influence inflammatory components of your lifestyle, of your diet, by increasing interleukin 10 through exercise, caloric restriction, and sunlight, reducing TNF, tumor necrosis factor, by once again, exercise, caloric restriction, improving omega-3 oils through certain food, and decreasing omega-6 or maintaining a proper ratio of omega-6 through certain dietary choices. So these are some simple, practical things that you can implement into your life to reduce your overall systemic inflammation. Once again, not to be a low back fix, because just simply put, in my experience, that's not going to be a full solution for low back relief. If someone is sitting 10 hours straight, has awful mobility, has a disc issue, a nerve issue, they need a movement-based solution. For a movement problem, you need a movement-based solution. Could these dietary influences help? Certainly, especially if that nerve root is super inflamed, or that disc is very inflamed, or just generally speaking, they're an unhealthy individual who needs to improve their overall fitness and well-being. That's obviously going to help any injury, not just low back issues, but any injury. So these are things that would be wise to implement just for your overall life, to live a higher quality of life, to have overall better well-being, but could be an additional assistance to your low back recovery. And these are things that I do discuss with my clients so that we can make sure we're attacking these issues from all angles. And if you are struggling to find help with an injury, or specifically a low back injury, I'd be honored to help you. I will include additional notes to other videos where I discuss healing disc-related issues, or the other podcasts where I discuss inflammatory components of low back issues in the show notes of this. And if you would like to work together on this, there will be a link to submit an application for my coaching so that you and I can meet one-on-one together, go through an assessment, figure out what structured plan needs to be put in place to help you resolve your low back issues on your own, so you can figure out how to fix it on your own and create sustainable changes for long term. I thank you very much for listening. And if you enjoyed this podcast, whether you're watching on YouTube or listening on your favorite podcast platform, please leave a rate and review. It helps significantly to expose the podcast to a greater audience. And if you're on YouTube, please like, comment, subscribe, leave a comment for the algorithm. It does help as well. Thank you very much for listening. Thank you for your time and attention, and thank you for your interest in me, in low back issues, in the things I have to say. I'm honored to have the opportunity to speak with you and to help in any way for those of you out there who are struggling with low back issues, looking for help. Thank you very much for listening, and have a great day.